What's up, everyone? Welcome to our first podcast where 4 James Madison University students discuss healthcare across the world. We're in a class together that discusses the United States and global healthcare systems, and we just want to spread information that many people might not think to consider. I'm Annie.
I'm Claire.
I'm Maddie. And I'm Alexa.
Today we're going to dive into Argentina, and we hope everyone gets a better understanding of the strengths and flaws that come with their system.
A couple weeks ago, we decided to reach out to Argentina's government to sponsor today's episode. They eagerly agreed, stating that they want everyone to know the good and the bad about Argentina's healthcare system. They want, first, to educate those who may not know about it, and second, to bring awareness to the issues that can possibly be fixed. Because Argentina is currently ranked 75th in the world for healthcare, even though it's considered one of the best healthcare systems in South America. The major cities such as Buenos Aires, Cordoba, and Mendoza have very good hospitals and clinics, but once right outside of the cities, the healthcare begins to decline. Argentina's healthcare is pro-rich, tends to favor the people who have more money. This is because the healthcare is into different sectors, so those who are able to pay for better healthcare are able to get it. Overall, I do think we agreed that while Argentina's healthcare system is set up well and for the most part performs well, its outcomes are not what they should be for a country of their economic status. So we did agree that we think the US's healthcare system is better in most aspects, but Argentina's is better in other aspects. But overall, the US pulls ahead.
Although we believe that the United States healthcare system might be better than Argentina's, their soccer team is definitely ranked higher than ours in the World Cup. We can all agree on that. In terms of major health issues, both the US and Argentina have pretty comparable major health issues. Cardiovascular disease ranks among the top leading causes of death in both countries. In Argentina, it counts for about 34% of deaths due to non-communicable diseases. Cancer is also among the leading causes of death in both countries, with Argentina having lung cancer being extremely common due to their air pollution and tobacco use. Respiratory diseases, chronic kidney diseases, and diabetes are also among major health issues in both countries. And when providing care, both healthcare systems use a more disease management focused approach instead of a preventative focused approach, which could help to prevent these diseases from becoming bigger health issues or could minimize the amount of deaths from these.
So Argentina's healthcare is decentralized, meaning that it is regulated at the federal level but administrated at the municipal level. For example, their primary care is managed by individual cities. So depending on the amount of money that those areas have, their healthcare would vary.
When we talk about comparing the United States healthcare system to Argentina's healthcare system, there are many times where the United States is more superior than Argentina, but there are also a few times where Argentina is a little bit better than the United States healthcare system. The US spends a lot more money on healthcare than any other country, which is one of the United States' best feature about their healthcare system. U.S. patients, they are more likely to experience post-discharge complications and require readmission to the hospitals than other patients in the United States do. And the U.S. patients also are more likely to report certain medical errors and delays in receiving abnormal test results than patients in other countries were. But overall, the U.S. is seen to have great qualities and measures of their healthcare system. They're very efficient and they have access to care and they have rapid access to whatever you need. You can easily get things to you, get things done. You can easily just have a specialist opinion in the United States, which in some other countries like Argentina, they struggle with having that knowledge and power and money. Argentina has great healthcare in larger areas of their country, but they lack that greatness in poorer areas of their country. They lack up-to-date medical equipment for more extensive treatments. And Argentina only spends 4.8% of their GDP on health, which is a big disadvantage compared to the United States, who spends 17.7% of their GDP. And the United States also spends $11,582 per American, which is a ton. However, if you are planning on getting plastic surgery and looking like a Kardashian, I do recommend that you go to Argentina because they are supposedly super good at plastic surgery. Just want to put that out there.
The U.S. and Argentina's healthcare system can also be compared at the economic level. As for their healthcare expenditure, Argentina spends roughly $946 per capita a year, while the U.S. expenditure per capita was $10,921 a year. That being said, the U.S.'s percent GDP was 19.7%, while Argentina's was only 9.51%. So while Argentina's healthcare is much cheaper, their economy is growing at a much slower rate.
Okay, I think that's all the time we have today. I hope you all enjoyed learning new beneficial facts about Argentina healthcare, and make sure to tune into the Argentina World Cup match this Saturday versus Mexico. They are ranked number 2 in the power rankings, so place your bets now so you have enough money to travel to Argentina to see their healthcare and country with your own eyes.
Bye, everyone.
Bye.